So I think we'll just get started if that's okay, because we're going to be tight for time. So just good morning, everyone, and welcome to Breakout 2, Improving Mental Health Literacy Through Youth Mental Health Promotion. So my name is Karen, and I'm going to be chairing this session alongside my colleague Roisin, who will facilitate the Q&A session. So there's going to be 4 by 5 minute presentations with one Q&A session at the end. So I just encourage you to put any questions you have into the chat box and include the name of the presenter the question is addressed to. So before we get started, I just want to ask everyone to mute their mic if you haven't already, and turn off your camera just to minimize any Wi-Fi issues that we may have. And also, can I ask everyone to click on presenter or speaker view within Zoom to ensure the speaker is spotlighted on your screen. So just then to introduce our first presenter, Maeve O'Reilly, a PhD candidate with Jigsaw and UCD. So Maeve is going to present on a qualitative evidence synthesis of school staff perspectives and experiences of adolescent mental health.
Great. Thank you, Karen. Just to check, can everyone see that okay? Great, super. Okay, so hello, my name is Maeve. I'm a PhD candidate in UCD and I work with Jigsaw. Broadly, my PhD focuses on mental health literacy in secondary school. And in this presentation, I'm going to talk about a review of qualitative literature that is currently ongoing. So beginning with a little bit of background, we know that school staff play a really key role in youth mental health. Teachers and other school staff often act as supportive or trusted adults for students. They also obviously spend a lot of time with students, sometimes seeing them every day, and can often be one of the first people to notice changes in behaviour and can identify if students are struggling. And also, as research tells us, many school mental health interventions include or even rely on school staff to deliver content to students or to enact change in the school. As such, it's really important that the views of school staff be taken into account when designing school interventions. We also know that there's been a lot of research done looking at school staff perspectives of youth mental health, as well as staff confidence in addressing issues and what role staff play in terms of their students' mental health. However, to date, there hasn't been any synthesis of the literature in the area. By that, I mean like bringing together all of the existing literature in the area. So that's what we wanted to do. We wanted to look at the literature around teacher perspectives and experiences of youth mental health and answer the following. Firstly, what are school staff members' experiences of working with students with mental health difficulties in school and the classroom context? Secondly, how do staff perceive their role in supporting student mental health and well-being? And lastly, how do staff feel schools can support students' mental health in the school context? So we're looking really broadly across the literature to answer these questions. So how we did this was with a really comprehensive and systematic review of the literature. We looked at psychology, education, medical and nursing research databases, looking for articles that included the following. So school staff in secondary education, be that teaching staff, school management, support services, etc. And the articles also had to include perspectives and experiences of some aspect of youth mental health. So this could be teaching staff's understanding of youth mental health promotion, or how guidance counsellors feel about offering support to a specific group of students in need. And we also focused on qualitative research because, given the phenomenon of interest, interview studies, focus groups, etc., would offer a much kind of deeper and richer insight than a survey or a trial. We also focused on articles written in English and articles that had been peer reviewed. After carrying out the database search and reference list search, myself and another Jigsaw researcher, Maria, screened almost 4,000 titles and abstracts. We whittled this down to 121 articles, which we read cover to cover, and then we finally got down to 59 articles that looked at secondary school staff experiences and perspectives of youth mental health. So looking now at some of the characteristics of the articles in question, the articles spanned from 1983 to 2020, but as you can see, the majority of the articles were from the last decade. The majority of the studies were also qualitative, so interviews and focus groups, and there was 2 case studies. Some were mixed methods. These were mostly survey studies that had open questions asking staff about their experience. And overall, we're looking at a collective sample of 3,223. So essentially the voices of over 3,000 school staff members from around the world. Speaking of around the world, here are where the final studies are from. We have 18 countries represented. The highest number were from the UK with 13 studies there, 1 from Northern Ireland, 12 were from Australia, 10 from America, but we also had studies from really far-flung parts of the world, such as Nicaragua, the Gaza Strip, Vietnam, Kuwait, and so on. So moving then to next steps, and as I said, this study is currently ongoing. So I'm currently extracting the qualitative data from those articles, data here being all of the direct quotes from participants, but also all of the study themes and author interpretations. So the next major step then is to analyze those by first coding them line by line, and then developing themes that will allow for a summary of the data, but will also go deeper and answer those questions that I showed you at the beginning around staff experiences and perspectives of youth mental health. After that, we're going to assess the strength or the quality of the evidence.
Sorry, Maeve, you just muted there.
Yeah, okay, great. So we're going to assess the quality of the evidence, which will allow us to make recommendations for policy and practice with confidence. So the findings of the review then are going to collate the perspectives and experiences of a really diverse mix of secondary school staff from around the world. It's going to tell us about the mental health issues that school staff see as important in schools and how staff understand their role, as well as tell us what staff feel is needed or missing in schools. And this will help us to better inform interventions and initiatives so that they echo the real life experiences of school staff and are relevant and useful to them and their students. Thank you so much.
Thanks, Maeve. So now moving on to our next presenter, Dr. Louise Rooney, Research and Evaluation Coordinator in Jigsaw. So Louise is going to speak to us about piloting a whole school approach and overview of key findings from Jigsaw's One Good School initiative.
Can everybody see that? Yeah. Great, thanks very much. So like Karen said, my name's Louise and I'm Research Coordinator in Jigsaw. And today I'm going to talk to you a bit about the evaluation of the pilot initiative, One Good School. Myself and Karen have been working on it for the last kind of 6 months. So we'll jump straight into it. So One Good School is a complex multi-component initiative that offers schools a suite of 17 mental health activities for all members of the school community, including students, staff, parents and caregivers. And this initiative aims to improve the mental health literacy of the school community through improved mental health knowledge, reducing stigma, increasing help-seeking behaviours and self-care strategies as well. And here you can see this is our suite of activities. So the aim of this study was to evaluate the acceptability and feasibility of the One Good School pilot to ascertain whether the initiative was in fact meeting the needs of the school community. And today I'm going to talk to you and share some of the findings from our workshop evaluations. So their evaluations from those 17 areas of activity I just showed you. So the One Good School activities were evaluated using online or paper-based anonymous feedback forms that were distributed to attendees either pre and post workshop or just post. 4 of the workshops were evaluated in all participating schools as they were considered central to the success of the initiative and were new to Jigsaw services. So these workshops were basically rolled out in all 80 schools. So the first of these workshops was leadership training, which was a 1-day course offered to school leadership staff. And this included principals, deputy principals, year heads, guidance counsellors. And the key learnings for leadership training focused on providing a framework for supporting and promoting mental health and mental health and wellbeing in schools through self-care, supporting student mental health and a whole school approach. So participants completed pre and post surveys, and the findings showed that leadership's understanding of how to support a whole school approach to mental health and well-being increased, and so did their awareness of barriers and enablers for student help seeking behaviour. Some of the key learnings were that school leaders need to look after their own well-being in order to be fully present to the staff and students in their school. So there were also teacher online courses, and they focused on the importance of adopting a whole school approach to youth mental health, as well as strategies to promote, support and respond to young people's mental health needs. So over 1,400 teachers took part in these courses. And you can see here that there were significant changes in that teachers were better able to define what mental health means, and significant increases in knowledge and skills, as well as confidence and competence to support student mental health was also observed. And just some key learnings here from feedback that we got from the teachers. So I'm not expected to be an expert, but doing nothing is not helpful, and trying might just make a difference, and maybe I could be that one good adult to more students. So Innovate for Wellbeing was a 2-hour workshop delivered to transition year students over 3 classes. Students designed a project outlining their thoughts and feelings about mental health and well-being in their school, and this workshop specifically aimed to give students a voice. So 86% of students found that the program was enjoyable. 83% reported that Innovate for Wellbeing, the project was a good way for letting their school know about areas of mental health that were important to them. And 71% felt that their school listened to the issues their project addressed. And just a quote here: "I enjoyed working with my friends to come up with ideas to help people within our school community." So finally was the parent and caregiver workshops, and this was self-care for parents, was what the workshop was called, and it aimed to provide parents with a better understanding of what self-care is, highlight the importance of looking after their own mental health and well-being, and provide them with self-care strategies that they can implement as needed. You can see here that 89% reported increased understanding of the importance of self-care in their role as a parent. 88% found the workshop enjoyable, and 89% felt more aware of their self-care needs. And just a quote: "Very helpful information and an eye-opener. I will be making changes in my life." So overall, the feedback for students, parents and school staff regarding the One Good School activities were extremely positive, in that they reported them as being helpful, enjoyable and useful. And the feedback also it leads us to the findings suggest that the One Good School activities were both feasible and acceptable in the school community, which is good news for us. Thanks very much for listening.
Thanks, Louise. So our next presenter then is Dr. James Matthews, a lecturer in UCD's School of Public Health, Physiotherapy and Sports Science. So James is going to talk to us about the role of sports coaches in supporting young people's mental health, assessing the feasibility of the One Good Coach workshop.
Thanks, Karen. Just hopefully everyone can see the screen okay. So good morning. As Karen said, my name is James Matthews, and just thank you to Jigsaw for the invitation to speak to you today about this research, which is evaluating the One Good Coach online course. So I suppose really, what is the One Good Coach course? It was developed by Jigsaw and was originally delivered on a face-to-face basis to sports coaches. However, it was transformed into an online offering in order to provide it to more people. And the online course takes about 40 minutes for people to complete, and is self-directed. Why is it important? We know that levels of anxiety and depression have increased in young people in recent years, and the supporting environment is a setting which could be used to promote young people's mental health. And indeed, recent research has highlighted the relevance of the coach's role, And there has been some promising brief interventions delivered in sports settings, but these brief interventions have typically been delivered face-to-face. Thus, there's a need to consider how we can scale these types of courses to support more people and make them more accessible for long-term sustainability. So really the aim of this study was to assess the feasibility of the online version of the course, focusing on its acceptability to sports coaches, and then its preliminary efficacy in increasing coaches' knowledge and confidence and intention to engage in mental health promoting. The study was a single-arm and non-randomized pre-post study, which took place in the sports of swimming and rugby and was endorsed and supported by the national governing bodies of those sports. Coaches that chose to participate completed a survey at baseline and then at 1 week and 12-week follow-up. And the survey examined sort of mental health knowledge, their role breadth and role efficacy around the sports coaching and engaging in these behaviours, an intention to engage in mental health promoting behaviours, and then also the satisfaction with respect to the online course itself. We also interviewed a subsample of coaches over Zoom. So in terms of the results, I think it's first important to say that we had quite high levels of dropout from the study. So we had 67 coaches complete the baseline survey, but only 12 completed the 12-week follow-up. So therefore, we focused on coaches who gave us complete data sets at baseline and 1 week follow-up. And that was 37 coaches. And of those 37 coaches, we also interviewed 15 of them after they completed the course. In general, the coaches were very experienced. As you can see on the screen, 80% were over 40 years of age, had been coaching for at least 10 years, coached an average of 9 hours per week. And it was predominantly, I suppose, a male sort of coaching cohort that took part in the study. So drilling down to look at maybe some of the findings from the survey itself. Well, we found that the online course had no effect on coaches' mental health knowledge at 1 week follow-up. But there were significant effects for role breadth and role efficacy, so coaches' beliefs about engaging in these behaviours as part of their role, and their confidence to engage in these behaviours as part of their role. There's also significant effect for intention to promote mental health. But while these results were significant, the effect sizes were quite small, so it's important to note that. And then finally, in terms of acceptability to coaches, the coaches were very satisfied with the programme and would recommend it to sports coaches. It was a promising finding. So looking at the interview data and what we found, these were organised under two higher order themes. On the left-hand side, there's a theme around the relevance of the course to sports coaches. And on the right-hand side, it's a more broad theme looking at sort of the role of the sports coach in promoting mental health to their athletes. So just due to time constraints, I'm just going to note some of the key lower order themes that are on your screen. So in terms of motivations, a prominent motive for undertaking the course was coaches recognising the importance of mental health in young people and their desire to develop knowledge to support that. And this is highlighted in different ways, with some coaches describing experiences they'd had with athletes who needed support, and other coaches wanting to be ready that if a young athlete came to them as to how they could support them. In terms of embedding the course within their sports, there was a perception that it should absolutely be kept online, and that was an appropriate medium to deliver this introductory information. And secondly, coaches were in broad agreement that this could be put in as an important part of their coaching qualifications. On the right-hand side of the screen, just very briefly looking at the top lower order theme, I think coaches revealed they felt they had a role that went simply beyond coaching sports skills to a more holistic one, one that can make a difference to young people's lives by being engaged and present in and around the sports setting. So in summary, I think what we know is that the study found evidence that a brief online single session intervention can positively affect coaches' beliefs regarding mental health promotion, and that it was acceptable to these coaches. However, we note that refinements and longitudinal testing are required to further strengthen the evidence base for this approach. And then just very finally, I think the findings also suggest perhaps that sports clubs and their associated national governing bodies can have a role to play in supporting their coaches to develop the knowledge, confidence and skills to promote mental health to their athletes in a holistic and integrated way. So thank you very much for your time, and just a quick show of the acknowledgements for the study. So thank you, Karen.
Thank you, James. So now, last but not least, we have Rebecca Murphy, Youth Mental Health Promotion Coordinator at Jigsaw, who will present to us about engaging with communities online to promote youth mental health during COVID-19.
Hi there, my name is Rebecca Murphy and I'm a Youth Mental Health Promotion Coordinator with Jigsaw, and I'm here to talk to you about how we engage with communities during COVID-19 to promote youth mental health and wellbeing. So I suppose before the pandemic, Jigsaw have delivered multiple youth mental health promotion workshops in community, so 5,000 up to March 2020, and that would have been delivered to approximately 145,000 professionals, volunteers, young people and parents or carers. So quite a strong presence in the community when it came to our youth mental health promotion work. Our COVID-19 response then obviously required us to pivot some of that face-to-face work to an online setting. So we did some synchronous work, so live delivery of workshops online, and then some asynchronous work which was self-directed learning accompanied by some live elements if desired. So the synchronous workshops I'm going to talk to you about are One Good Coach, One Good Adult, and Self-Care for One Good Adult. And these 3 workshops were 3 face-to-face workshops delivered to adults who work or volunteer with young people in different contexts, and we chose these workshops because we wanted to convert adult ones in the first round, as we felt that it was a slightly less risky audience, I guess, than converting them for young people, especially in an initial kind of unknown phase where we didn't know how long the pandemic lockdown will be going on for. So this is what we chose. So part of our conversion of these workshops to an online delivery via Zoom, we carried out an analysis of them using a number of pedagogical models, including Julie Salmon's model, Bloom's taxonomy, and others. And we rolled out a really comprehensive program of staff training and development around delivering workshops online, including live sessions as well as an online course. 70 staff were trained overall, and they delivered between July 2020 up to now. They've delivered 203 of those workshops with 3,201 participants in total. And you can see the feedback is really good on these workshops. 91% found them useful or very useful. 95% found them well facilitated or very well facilitated. So the feedback has been quite good. The other element then, the other side of things, was the asynchronous. We've traditionally had a really strong relationship with Belong to Youth Services and LGBT Youth Service. And as part of our work with them, we usually deliver a day-long face-to-face workshop with them. We converted that to a blended piece as part of our COVID-19 response. So there was an online self-directed course and a 3-hour Zoom live workshop. We had 2 workshops scheduled in November and December 2020. A phenomenal demand, even when we added 2 extra dates, and we had 200 on waiting list. So we then had to redo and go for a plan B around our COVID-19 response, where we developed an online, completely self-directed, self-contained course that has unlimited capacity and people can do on their own time. And it had kind of interactive elements like storyline, built on storyline, imagery, videos, animations, and we really wanted to make it as engaging and as interesting as possible. And again, you can see that the feedback has been really strong from this online course, and we continue to have a huge amount of enroll as of today. We have 555 people enrolled on that course. So what did we learn? So I guess flexibility really was needed in this. So for example, when we converted our workshops to a live online delivery, we chose Zoom as our main platform. We then had to look at using Teams, Microsoft Teams, because a number of schools or different organizations couldn't use Zoom. We also utilized pilots for the LGBTI workshop and others, which gave us great feedback on the workshops. It's a different skill set for online delivery, and I think bearing that in mind and like developing your skill set is really important around that. Automating as much as possible within our learning management system was a really, really helpful thing to do as well. We did consider integrating different types of software into our online live delivery via Zoom, so things like Kahoot or Padlet, but we didn't want to kind of overcomplicate things as such when our facilitators are kind of already getting used to a brand new environment. Adding something else and we thought might just complicate things too much. We also learned that we do want to retain some of these elements beyond COVID-19 as well. So some of the recommendations for practice then, so ongoing training and support is so important for staff in this. When you invest in technology, it's not just about investing money, it's also about investing in time and learning how to use it. Using kind of really sound pedagogical and instructional design approaches is really important for giving yourself a solid evidence base for when you're converting these workshops or converting your existing programs to an online kind of digital platform. Over-recruit for live workshops, because there does tend to be a drop-off between recruitment and attendance, even more so than there are in person. And universities aligned for learning principles are so important, especially with our online work and our e-learning self-directed courses. And applying those principles has been really important and something that we continue to try and do in our work. And also reach out for support. I think something that we have learned over the last year is that a lot of people are in a very similar situation in terms of learning how to do new things in the new environment. And so there's kind of nearly always someone out there who will give some support. So thank you very much. If you have any other questions, please feel free to email me, or you can visit those websites to see some of those workshops in action.
Thank you to all our speakers. We're now going to have a brief Q&A session. So if you have any questions, you can put them in the chat. So there's a question for Maeve. Do you find that One Good School helps to promote a culture of mental health amongst all of the teachers in the school?
Sorry, there is a serious lag on my side. Thanks, Caroline, for that question. I'm not sure if this would be a better one maybe for Louise to answer. Just when she was presenting their One Good School, I did interview teachers as part of the One Good School evaluation. And a lot of them did speak to changes happening in school that they've noticed as a result of One Good School, conversations happening in the staff room, conversations happening amongst young people. So I would say that, yeah, One Good School did definitely help to promote mental health across the staff. But Louise, if you want to add anything from the One Good School evaluation side, feel free to come in there.
Yeah, it definitely what we're finding is that awareness certainly was increased for all of the groups, and teachers being one of them. Like Maeve said, starting conversations and learning terminology and changing the way that we talk about mental health, those kinds of things. So yeah. So how many of the courses, Roisin, is it all right if I take oh, sorry, I'll leave it to you, sorry.
Sorry, that's all right. There, another one for Maeve. Have you found an increase in engagement in the programme since the pandemic? This will probably be our last question just due to time restraints, but there you go.
Again, sorry, there is a major lag on my side. Again, I think I'll pass this question over to Louise because she will definitely be able to say more about engagement rates. Or I think Siobhan is also in the group here.
Siobhan, do you want to take that one, or I'm happy to take it either?
Yeah. Hi, Louise. I'm here if you want me to take that.
Yeah, go for it.
Yeah, so I mean, I think when Louise speaks about the evaluation, it was specifically for our pilot One Good Schools initiative, which we implemented. We started in 2019 and had hoped that it would run for one academic year, but because of the pandemic, obviously, and school closures, we extended it for 2 academic years. So we concluded back in May of this year. So, I mean, I think essentially we would have had to translate some of what we would have delivered face-to-face into online and deliver that to students and teachers as part of concluding the initiative, and also obviously so that we could conclude the evaluation. I mean, schools have been closed now since May, so we're back up and running since September, but we are recruiting now currently for our new One Good Schools initiative, which doesn't actually start until January of 2022. So we're continuing to do some work with schools in between with the existing One Good Schools, but hope to extend the number of those involved so that we can have additional schools come on board in January 2022.
Thank you to everyone in this session and all the speakers for participating and your engagement. You can now leave this session and go back to the main page to join your second breakout session. Just as you did coming into this one, click the correct breakout one, which will begin at 11:15 after a brief tea and coffee break. So thank you to everyone.